That role that you're describing, and I believe it's Dr. Simpson,
Thank you.
what sort of things encompass a day of yours?
Well, actually, I'm on a nurse-run pain service, which is really an unusual kind of situation in that anybody in the hospital that has pain, they call us. We go out and we see the patient, we do a full assessment, and then we call that primary team, whether it be urology, surgery, internal medicine, whoever's in charge of that patient. We give them our recommendations, and then we talk about how we can make that patient more comfortable, increase their level of function, make them more satisfied, and get them out of the hospital sooner. By doing that multimodal approach, we can make sure that we do the right things for that patient so that they can get out and get going.
Now, I believe you said that you make recommendations to these various teams as opposed to, and in many states, nurses can write their own orders,
Right.
but you have the physicians do this in your center. Why is that true?
Because I think we need to make sure that we educate our physicians and nurses. I'm in a teaching facility, and what that means is if you realize that there are very few nurse-led pain services in the United States, very seldom do you see somebody who's really willing to work with that patient who's in pain and talk about using multimodal analgesia, accessing their different pathways so that they get the best pain control, and then kind of moving them on past that. And unfortunately what happens is if we do it for them, if I just take over that patient's pain, that physician never learns how to do a good job down the road. And they're not likely to stay at Kansas, which we'd love to have them, but if they move on and go somewhere else, I want them to take that knowledge base with them and make sure that they continue to take care of lots of patients along the road.
And then whoever they teach, it goes on and on and on, and they've learned the reason why.